Hi, my name is Karen Metzler and I'm with the Breastfeeding Alliance of Northeast Wisconsin. I'm here to give you an update on the most current research on tongue tie. We received a grant from the Wisconsin Association of Lactation Consultants. The Breastfeeding Alliance, or BFAN, is a group of local breastfeeding advocates, including people from the government, WIC, different counties, cities, and including lactation specialists from the various hospital systems in the area. Some of you may know me. I'm a genetic counselor. I've previously worked at both Affinity Health System and ThedaCare in the Fox Valley, so we may have had mutual patients. So each of you have a copy of our handout, so I just wanted to run through that with you briefly today. If you have any questions, you want to learn more, talk in the future, I'm so happy to come back and talk more. But as you know, this is a brief, approximately 10-minute talk, so I'm going to go pretty quickly and just hit the highlights. The new definition of tongue tie is more of a functional assessment. You can see on the cover page from the International Affiliation of Tongue Tie Professionals. It is defined as something that restricts normal tongue movement, the frenulum underneath the tongue. When we think of tongue tie, we normally think of the anterior tongue tie, which you can see a picture here where the frenulum comes to the tip. There's a new term called posterior tongue tie. You can see pictures of a posterior tongue tie here. This is when the frenulum is hidden and it's further back, and it's harder to visually diagnose. It's more of a functional assessment. And I also wanted to touch on an even hotter topic in lactation, the maxillary lip tie. This is less evidence-based and more case report-based, but I think there's going to be a lot more to come. It makes sense if the frenulum to the upper lip is too tight and you can't phalange your upper lip out, that's going to affect being able to get an adequate latch and staying on the breast, so it's going to affect breastfeeding. So research is really clear. Tongue tie can cause breastfeeding difficulties, and I have done a thorough literature search. I've read virtually every article that's been published, over 80 articles in the literature in the past 20 years on tongue tie. I skipped some of the articles, some of the specific laser information, laser technology, some of the dental articles, and some of the molecular genetics articles, although I have a personal interest in that, wasn't really applicable at this point. So I did want to mention that the people in the field of tongue tie think that if there's an evident lip tie, that's a pretty good indicator that there might be a posterior tongue tie. So that is an easy way to think about there could be a tongue tie as well with this baby, because lip ties are much easier to see. And I did want to also point out that every situation is unique. So the literature at this point in 2013 says that about 30% of tongue ties will cause problems and the other 70% does not. So that's important to note as well. Every situation is unique, especially thinking about breastfeeding, also based on mom's anatomy. We do also believe, or I believe, that tongue tie is associated with gastrointestinal problems, including reflux. It makes sense because of the aerophagia, or swallowing of the air, because of the incorrect tongue peristalsis or wave-like motion. The baby or people can swallow too much air, which then causes the reflux. Furthermore, I've also read that incorrect peristalsis starting with the tongue causes incorrect peristalsis going down into the intestines, so therefore that could be associated with disease. So these are all case reports. I believe it to be true. I joined a support group 5 years ago, and I was the 8th person to join. Now there's over 8,000 moms. I've seen a lot of people report that their babies have had increase in reflux symptoms after they've had their tongue ties fixed. But the evidence is not there. So in my opinion, it's not quite evidence-based. There's no large studies at this point, but that is research that's happening right now. So we'll need to stay tuned to what happens with that. If you go, you'll learn a little bit more about my story. So briefly, my husband is a primary care physician. He does family medicine and sports medicine. And when he was in med school, he came home and said, "You're going to breastfeed." And I said, "That's weird. No one in my family breastfeeds." But he's like, "No, it's very good for you. It's very good for the baby. Like, this is what's going to happen." So I had several years to acclimate to that. Our oldest daughter was born, and I was going to breastfeed, and that was great, and I was totally on board, except it didn't really work. We didn't know why she was losing weight. We couldn't figure it out. So at 2 weeks of age, we kind of realized maybe it's this obvious tongue tie that, her tongue is tied to the tip. My husband was tongue-tied. He had speech articulation issues. He remembers being physically held down at age 3 to have that clipped. So it does turn out it seems to be dominant in my husband's family. So we took her to the physician, and we had that clipped, and I thought life is great. At a month of age, she was weighed, and she was nursing about 20 hours a day. It was the most terrible time in my life, I'm sad to say, because I just did what I was told to do, just nursing nonstop, cried, 8-10 times a day. It was really painful. And she wasn't transferring milk adequately. So then we had her weighed at a month of age, and she was still pretty significantly below her birth weight. So then we started supplementing. I used a supplemental nursing system for a month, kept seeing different people, a speech language pathologist. She had, just in the context of my husband's job, had been seeing several physicians unofficially. Of course, her own physician. She had seen an ENT. And the 9th lactation consultant did a quick assessment and said, she's still tongue-tied. So we went back and said, we want this revised further. The physician didn't really believe it and said, well, if you're telling me, if they think it's a problem and you want it done, I will do it, but I will do it under general anesthesia. So of course we said, absolutely. He did the procedure under general anesthesia. She came out and was able to nurse and transfer milk adequately from then on out, and I was able to nurse for the full year. So that is my story. I joined the support group, and it was kind of depressing because I keep reading about moms going through the same things. So I got connected with the Breastfeeding Alliance when one of the area physicians wanted to learn more about tongue tie. And then I said, well, what more can we do? Let's apply for a grant. So that's kind of how this was born. So I just basically have reviewed everything, and I'm explaining to you what's evidence-based, kind of what's being thought about, and hopefully we can get babies with tongue tie treated earlier, and the moms don't have to go through such a frustrating process that I went through. So the first article is from the AAP section on breastfeeding newsletter from the summer of 2004. This is the first time posterior tongue tie was used in print. There's some pictures. You can see they outlined a classification system. Type 1 and 2 tongue tie are more anterior, closer to the tip. Type 3 and 4 are more posterior, need a digital assessment to examine function. The next article shows that fixing a tongue tie using a procedure is not a placebo effect. So they took 28 babies in a control group, 30 babies and did the procedure on, brought back to mom. Mom didn't know if their baby had the procedure or not. They examined breastfeeding and pain scores and showed there was significant improvement, decrease in the pain scores and increase in the breastfeeding scores in the babies that had the procedure. So that was this article is in Pediatrics just from 2011. And I should say the term posterior tongue tie being termed in 2004, it's not that long ago. That's only 9 years ago. It takes usually at least 10 years from things in the literature to get into clinical practice. What we're just trying to do is to expedite that. Let's bring this information in. And let all the physicians know that this is kind of what's going on. It's even, the lactation consultants are learning about this as well. The next article is really neat, I think. This is also in Pediatrics from 2008. This group is based out of Australia. They do ultrasound imaging, and they showed that some babies with tongue tie have normal sucking mechanism. That's a different article. I didn't include that article, obviously. There's like 15 articles I would have loved to include, but we're on a budget. Furthermore, we had to receive copyright permission to hand these out. We only have a certain number of copyright permission, and we did have to pay for some of them. The AAP was excellent and let us re-release their pediatrics information, so that was pretty exciting. They showed that some babies don't suck normally, and they showed that the sucking mechanism increased, or improved, I should say, after the procedure was done. They did a frenulotomy procedure. Furthermore, they checked milk transfer, and they showed that milk transfer increased after the procedure. And the next article is by a physician out east, Dr. Cliff O'Callaghan. He revises these babies without general anesthesia, even the babies with the posterior tongue tie, which is a little bit harder to do than a simple anterior tongue tie. He does it in an office setting without general anesthesia. He wrote this article up. He had 299 babies. About 85% of them had the posterior tongue tie, and they showed statistically significant increased latch scores and decreased pain scores in these babies. I'll talk a little bit about laser versus scissors in a little bit. The next article is kind of the intro article. This is very new. This is, no, this one's not as new. This one is a couple years old. And this article is by Dr. Kotlow. He is a dentist out east, a pediatric dentist, and he does a lot of training on tongue tie. He uses laser to revise the babies and does a lot of people go and train with him a lot. So he talks about, he's done over thousands of revisions, but 50 babies have had significant reflux that have shown improvement after the procedure, but he outlines 2 cases specifically. So if you flip them to the first page, you can see case 1, this distended abdomen on this baby. It's quite distended. This baby had multiple problems breastfeeding, tried multiple different formulas, was on reflux meds, actually wasn't developing normally, clenched fist, arching back, crying most of the day, saw developmental pediatrics, saw neurology, had genetic testing for some developmental abnormalities because the baby wasn't developing normally. Was scheduled for a barium swallow test, and the parents of this baby talked to relatives. This can be highly familial. Again, it's about 30% of babies. I think there was 2 studies that asked this question: is there a family history when there was tongue tie? And it was about 30% of the time there was a family history. Clearly, more work needs to be done in that, and that's something that I obviously have an interest in as a genetic counselor. But so they found out from a family member reflux can be associated with tongue tie. They were scheduled for this barium swallow test, canceled that appointment, instead went and saw the author that same day, diagnosed with a lip tie and a tongue tie, had that laser within 24 hours, symptoms improved, and this was at 8 months of age. So this baby basically cried nonstop for 8 months and had reflux and different testing, and then by a year of age, the baby was off all medications for reflux and developing appropriately for age. Case 2 highlights the importance of tongue tie. It can still affect bottle-fed babies. The babies that are bottle-fed still may not have adequate swallowing. They may be leaking milk, gagging, kind of like almost choking on the milk or the formula. So this is a case. The baby was bottle-fed, kept releasing suction at the bottle, had gagging, crying, reflux, was prescribed medications for reflux, and the baby was in with older siblings seeing the author of the paper. He identified the tongue tie, did the laser procedure. After 8 days, the mom indicated that there was no longer any symptoms. So there's, kind of thought that tongue tie is related to colic, and an underlying cause of colic may be gastrointestinal pain. So that if those studies need to happen, I'm just letting you know the case reports are out there. There's a wealth of belief that that's related, but I say it's evidence-based. There needs to be more things. The last article I've included, this one's really recent. It was published online in July of 2013, and I believe it's in the print version of Journal of Human Lactation in November. So this is also by Dr. Kotlow, talking mostly on classification system for upper lip tie and the upper lip tie related to breastfeeding. Upper lip tie is also associated with some teeth problems later in life, which I won't talk a ton about, but a gap in the teeth, increased risk of cavities. So then you might say, how the heck would I assess for a posterior tongue tie? Well, that's something that is not necessarily easy to do, and that's why it's important that we kind of believe that if someone has additional training to assess tongue function, that we believe kind of that it's not as simple as just seeing if the baby can stick out the tongue. So what we're doing, the Breastfeeding Alliance in Northeast Wisconsin, we've chosen to use this tool by Dr. Allison Hazelbaker, who's out of Ohio. She was frustrated that there was no standardized tool, so she created this when she was doing her master's project to assess who would need a procedure to fix the tongue tie and who wouldn't. So there's function items and appearance items. She states that if you just kind of practice this tool on 30 babies, you'll get a really good idea of what's normal versus what's not normal. So we're encouraging anyone that's interested, any physicians or lactation consultants, speech therapists, to get familiar with this tool to be able to identify these babies earlier to get them adequate help. The Breastfeeding Alliance, we're also doing some trainings, which is pretty neat. We're putting together a workshop where we're going to kind of lactation consultants and physicians, whoever wants to come to learn how to use the tool. So that is a work in progress, and we're planning on having Dr. Hazelbaker herself come up next fall in 2014 to do a workshop as well. And then the next page is resources. There is a book by Dr. Hazelbaker. It's kind of like the all-encompassing book. It's research-based on everything, and she goes back to the Bible and medieval times talking about tongue tie. I only went back 20 years. Dr. Jane is a family physician in Canada. People travel all over to see her, to have her. She uses scissors to clip posterior tongue tie. And she created a training video, and that is a really interesting video, and several physicians have checked it out. We own 2 copies as a Breastfeeding Alliance, so if you want, I have that with me today, and you can get that checked out, and I can get it back to me in a week. We'll figure that out. So that's been pretty well received, and if you're interested in doing the procedure, especially on posterior tongue tie, it's a pretty good. You'll get a pretty good idea of what the procedure involves. And then the last resource we have on our handout is the book Created for Parents. It's kind of nice. It's only $8. It's on Amazon, and it is available for immediate download. So moms that are kind of going through the process of a new diagnosis of tongue tie, kind of navigate